Strictly Sickly is a medical-related talk show. While informed, we are not medical doctors. Any advice given on this show should not be substituted for a professional medical opinion. Always consult your physician before making any changes to treatments or routines.
This is Strictly Sickly, and I'm Sarah Hatfield. And we have a friend on our show today, Katherine Heath. And Brad, as usual. And today we're talking about stuff and things. And I think ways to talk to the doctor so they don't think you're a
a-hole.
A pill-seeking crazy person.
Yeah. It's really hard to talk to them without, especially if you've got a chronic issues, not sounding like a drug-seeking pillhead. I mean, that's so hard. So all I ever tell my patients though is always bring it back to function. That's what I always tell them.
So what does that mean?
So describe the ways in which your issues are inherently not allowing you to be productive.
Okay, so like impacting your ADLs. And
definitely.
What's an ADL?
activities of daily living.
Okay.
Washing your hair, getting up out of bed, doing the dishes. Just normal stuff you do every day.
Oh, yeah, you wanted a water.
You're the worst host ever.
Or the best.
He was
Or the best.
sharing.
You're giving the guests the water and not the scotch.
No, I'm not a Scotch person.
Oh, yeah, you had my
Yes, I did. Yeah, no, I'm not a fan.
Oh yay! Hey, Julie can comment now since you're unblocked because apparently that's why we don't let Brad run things anymore. But so what do you do?
Especially when I was on the floor, because I was a nurse on the floor for 6 years at night, and that's inevitably when you feel the crappiest, because you've just done a whole bunch of rehab, you've gone through all your day, and then at the end, that's when you're in pain. That's when you're trying to sleep, you're trying to rest, but you can't. Either you've got some anxiety or your pain is just keeping you unbearably awake.
Yeah.
And the medications that we have ordered for you, or the medication that you have prescribed, may not be doing the trick. And definitely don't be afraid to tell your doctor that that's not doing the trick, but always relate it back to, I am still in a lot of pain. I've been taking it as prescribed. Thank you. And I'm still having issues trying to do A, B, and C. So as long as you relate it back to, this is affecting my life this way, I need something else. I need something better to help me function.
Yeah, because I'm always scared. Like after my arm surgery, I was scared to be like, "Hey, this isn't working." I didn't want them to think I was begging meds off of them.
Yeah, and that's sad. It really is sad. I mean, I've dealt with those people that, because as a nurse, you have to kind of be the eyes and ears, and your BS meter has to be on point. So if you're sitting there on the phone talking with your bestie and eating a bag of Cheetos telling me that you've got 10 out of 10 pain, I'm going to look at you dubiously. And I'm going to be like, I mean, of course, you've got pain medicine. I will bring that to
What
you.
about in the cases of people, though, that have something like chronic pain, so they're a little more... I notice doctors don't think I react how I should to pain.
No, and I get that. But at the same time, some people are like hyper focused. They're there. They're hurting. They want to just tell you what's going on, and that's fine. But if you're sitting there and then, oh my God, I went to go get my nails done, and this check while eating a bag of Cheetos, I'm gonna have a hard time believing that this is 10 out of 10 pain. And how I would relate 10 out of 10 pain, because how do you describe it? I would always describe it as, I'd rather you just cut it off. If I could just get away with not having this limb, I think my life would just be better. Can we just get rid of it? That's to me 10 out of 10 pain. I don't know if I've ever experienced 10 out of 10 pain.
I have.
Have you?
When Christy Weichel dumped me in middle school.
I say that's how I feel on a daily basis. If
Like Christy Weichel dumped you in
if someone
middle school?
could just cut my arm off,
Yes.
my life would be a lot better.
For real. And I really feel like that. Like, do I need this back? I think I could just slither around. I think I'd be okay. That's to me 10 out of 10 pain. And that may be something that you deal with on a daily basis. And that's something that you should convey is, I live my life feeling like maybe I could just cut it off.
People with CRPS do routinely cut off their own limbs. That's a thing that happens.
Yeah.
A guy in my group just tried to saw off his own leg.
Like, even whenever...
Tried. He did not succeed.
Yeah, that's the thing about the home amputation kits is they don't work very well.
Yeah, he hit bone and...
he watched Saw too much.
Yeah, I say he gave up about halfway through that.
At least 15 of your friends are like sending me texts and videos.
You gotta break it. You have to break it.
Yeah, first.
Yeah. Most people don't know that.
Things I cannot stomach doing.
Well, and like when my arm got run over or whatever, I had this like grossness on it that I had to like scrape off with a butter knife, because that's the thing that you do at home. And
Brad?
Your friend Dane sent me a cat video.
Okay.
well, that's valid. But even then, I didn't think maybe I should just turn it this way and start cutting. Like, that was such a thought in my
Julie
head.
says I had a heart attack. It hurt less than my hernia did. Yeah, women that have heart attacks often don't notice just because the symptoms can be so different.
It feels like heart pain or like heartburn all the times. Like, I had a lady that died because she was just eating Tums. That's how she felt. She felt like she had really bad heartburn. Not heartburn.
But yeah, I remember getting people in the ER, and you could tell, especially if they were super adamant about getting a specific drug. No, I'm allergic to morphine and Toradol and Tylenol, and I'm allergic to Ultram. It's got to be Dilaudid.
No, what's that D1? Yeah. And I'm like, Demerol? Like playing dumb? And they're like, no, not Demerol.
Not Demerol.
Claret D.
It's inevitably Dilaudid.
It's always Dilaudid.
That's the good one.
But the best way to know if they're pain seeking is if they always want their Phenergan. They want it shot in like really fast.
Oh God, yeah.
And they want Phenergan also. And I'm like, yeah, I don't want you to stop breathing. So.
I don't know anybody like that.
That's not.
Dude, I don't let them straight shoot Phenergan into my veins. It tears it. That's the reason you can't find a vein on me, is because I was in the hospital in Baylor for 10 days with that GI bleed. And they were giving me Zofran, but it stopped working. And so they started shooting Phenergan, and they were diluting it a bunch, but it just, everything infiltrated. But Phenergan's a potentiator. So if you take that before you take an opiate, it has a lot bigger impact, but it also has a lot bigger impact on your central nervous system.
Yeah.
So you Hendrix yourself.
I don't know. They like it. It makes them feel fun, I guess.
It doubles the, like, if I'm going to take a hydrocodone and I have Phenergan and I take one, I can take less hydrocodone and it be effective.
This sounds like a mostly female problem, to be honest, because I've never had any problem going in saying, like, ow, my thumb hurts. And they're like, here's some morphine, take a nap for 4 hours, and then we'll send you home.
Oh, Allie says play the I have a seizure video. Have you seen that, where it's a cartoon and the chick goes in and she's like, I'm having a seizure, and then she
just flails around
and then she lists all the stuff she's allergic to. I need the med that starts with a D. I don't know who made that, but I love them. It's hysterical. I'm allergic to wind, hard work.
Yeah, but I've gone in with just throwing up problems, and they're like, okay, we can fix that with some narcotics.
I don't think it's just a man thing. I really don't. And here's why. You don't have a rap sheet like Sarah does.
No.
She's got like this. If you took
I
out
am
her,
a frequent
she's
flyer.
like this big giant file of how many times she's been in there and like what fixes it. And that's when they start looking at you like, what do you...
It gets better though. Like, I haven't been to the hospital in a 6 months. So next time I go back, they'll be a lot more pleasant than they were last year when I went in for the blood clot 3 times and then the arm thing twice. Even though I had legitimate problems, it was still in and out, in and out.
Yeah, they'll look at you like a frequent flyer because they look at the chart and they're like, you were just here.
And a lot
Seems
of times
like they should read past the headline.
A lot of times I want to go, I was just here because y'all are idiots and you sent me home.
And legit, you should probably do that. Like, look, I shouldn't have gone home, but I was sent home, and now I'm having this issue.
No, don't insult the person that's allowed to put foreign objects into your body while you sleep.
No, it depends on who it is. If it's a nurse, no. If it's a doctor, pretty much say,
whatever.
Look, this is what happened last time, and you guys messed it up. Because they don't do anything. It's the nurses.
Doctors don't do actual work.
Tell that to Dr. Dang. He was putting all the work in.
Yeah, until he went to jail. I'm glad he's in jail. He tried to kill me. But, yeah, a doctor in Cleburne, he red flagged me a few years back. I kept going in with gallbladder problems, and he claimed I was drug seeking. Turns out he was selling narcotics to his patients for exorbitant amount of money. And touching little girls.
Ew.
So he's in jail now.
Yeah, that's really good.
And he had it coming.
He did.
And I'm glad I never took my daughter to see him. What is sound going?
It is not me.
Anyway, Julie says she's allergic to Valium and Percodan.
Percodan.
I haven't heard of Percodan in a long time.
It was totally her.
I know. I saw that. I was watching that.
What? I saw nothing. No, and it's really hard whenever you're in places like a rehab facility or whatever, because that's my main function is, nursing is. I've never really been anywhere else.
So to all your super fans out there in Facebook land, did you actually explain who she was? Ask her what she did? Why there's just this strange lady in here wearing scrubs that...
Everyone knows who she is.
Yeah.
There are a lot of people that listen and watch your podcast after the fact that don't watch live.
This is Katherine Heath, and she does medical stuff.
Wow.
Yeah.
Specifically, what is your job title?
Right now.
I really wanted to ask because I don't know.
That's funny. No, I'm like a patient assessment standard coordinator, which doesn't have anything to do with being on the floor. And the reason why I wear scrubs and not office things is because I expect my people to chart, but I don't expect them to chart if it's absolutely batshit crazy on the floor. Because I get it, and I've been there, and I know what it's like trying to do your documentation. And so if you walk into a patient's room in, like, non-scrubs, they look at you like you don't know. They're like, this weird lady came in here.
You're not family.
I don't know if she knows how to do anything.
Maybe she's just like that guy that was going into hospitals and giving people rectal exams, thinking everybody thought he was a doctor and just let it happen.
But like, how weird would that be? Like, some lady comes in with like a nice shirt and some pants on or whatever, and she's like, "Hey, did you call?
But it doesn't work the other way around, because you can totally buy scrubs at Walmart and just walk into places and be like, I need you to drop your pants."
I wasn't given like suppositories. Helping people to the bathroom.
Yeah, I'm gonna need the badge before I'm gonna need to see
I
the
can
badge
get you a
before I
badge.
let anybody.
I'll get you a badge before the end of the show.
Oh my god. So do a lot of the people you see also see a pain doctor?
Yeah, we actually had in downtown the facility I used to work at, a pain doctor on site. So they would actually, which is really cool, because then his patients could either come to us whenever they needed, or if they had a physician appointment with him, then we could just roll them downstairs with their driver's license and be like, "Hey,
Yeah.
here's your patient." So that was really cool. We had a lot of our doctor was really free with his pain medicine. He was like, "Still hurts? Let's slap a fentanyl patch on there. I bet it won't hurt anymore." And I'm like, "Can we not?"
Where's your office?
Yeah.
It's no longer open.
Oh.
They sold it.
I was gonna say I need to
That's
know.
the one that I wanted to bring you guys to, but they won't let me.
Oh.
Yeah.
Let's say, because my pain doctor's, like, are you below an 8? You're good.
Yeah, bye.
Go on home.
No, your pain's managed.
It's below an 8. You're fine.
Which is stupid. Because, like, anything below a 5, I'm like, okay, we can still function. Anything above, like, 6 and above, I'm like, why? How are you? What are we doing?
Yeah, my general goal with my doctor is a 6. That's the goal.
I feel like that's reasonable.
Yeah.
It's whenever it's like, it's an 8,
Yeah.
bordering on 9, and I don't want to say 10, because then that's like the kid who's crying wolf.
Yeah. Everybody saves their 10.
Everybody saves their 10 because they never know when they're going to have to use it.
I've used my 10 once.
Have you really?
Yeah, kidney stone, 4mm kidney stone.
Ow, they're
Yeah.
spiky.
Yeah, and it was stuck. And I used my 10 a couple of times.
God.
And actually, one of our watchers.
That's just what she screams, like, when she's just, like, you'd be walking, she's like, 10! 10!
One of our watchers is in the hospital right now with a kidney stone, and having a stent and everything. So I know that experience.
So what is your 10 like, though? Like, how do you act at your 10?
Well, usually I am more of a blank wall starer, but with the kidney stone, I couldn't disassociate. Like I couldn't get out of the moment, so I was pacing.
So that's why it was the 10, because you couldn't disconnect.
Pacing and rocking.
Yeah, pacing, rocking, going, why are y'all taking so long? The Toradol didn't do anything.
I need an adult. Yeah.
And, you like a 9 is the usual bad. I'm more of a blank out kind of person.
Well, and a lot of people are. Like, just like a lot of people when they get tattoos or whatever, they go into that subspace. And I know that sounds very, what is that? Whenever you do, like, chains and whips and things.
Yeah, BDSM at subspace.
Very much. And it's not just for BDSM. Like,
No, it's because
for pain.
It's because the endorphins and all that.
Not just the endorphins, but you just kind of zone out so that way you're not dealing with whatever is happening to you.
What show am I on? I'm just confused.
I'm just saying.
The other thing is, I start making crappy jokes and laughing at my own jokes. And that's why they think I don't hurt, because I'm laughing.
Yeah.
But I'm laughing because I'm hysterical.
And that may be a good thing to, like, preface.
You were pretty weird when you had the blood clot, like, and you couldn't breathe.
Yeah.
Because that was like sheer panic, because you were in pain, but you were also like, I'm going to suffocate to death. I can't breathe.
I was super amused with that. I can't. A 10 is like a GSW. I hate those surprise pains that come on for a few minutes, extremely intense, and then suddenly disappear. Yeah, I get one of those in my lower right side, and I'm always like, oh crap, what is that? I don't have an appendix.
I'm definitely dying.
Oh no. And then 5 minutes later, it's like gone. I'm like, oh, I'm stupid.
Oh, you were talking about stents earlier. Don't you have a little PSA about that? The thing they don't tell you?
If you get a stent and you stand up right after that, you're going to pee on yourself.
Stent where?
Huh? For the kidney stone.
Oh.
Because they have to dilate everything to,
Yeah,
mess around in there. And the nurse, after you pee yourself, will be like, oh yeah, that's the thing that happens. They don't tell you before.
That sucks.
I think they're amused.
Aw. That was a nice nurse. I'd be like, just FYI, this is gonna happen.
Yeah, the nurse after it happened was like, oh, that's a thing that happens. I'm like, what?
Sometimes we forget to say things beforehand, and then we're like, no, honey, it's normal, it's okay.
Like when the nurse handed me that bottle after I had Caitlin, the spray bottle, and I was like, what's this? And she's like, oh, it's just, for your area. I was like, what?
You got a spray bottle?
Huh? It was like a
for
water
your
squirter.
bits?
It was
Was
a
it for
water
your
squirter.
bits?
Yeah.
I didn't get a spray bottle for my bits. What the hell?
They told me that toilet paper was going to hurt.
Oh.
Yeah.
Okay, well, mine came out really fast, so that was a thing.
Mm-hmm. I don't know.
It was like 3 pushes in.
Yeah, I did that with Caitlin, but I guess because she was the first, and I think because she went so fast, there was some damage.
Rug burn?
It
Stitches.
feels like
Stitches.
Oh, see, no, mine was no stitches, but it kind of does feel like rug burn on your lady bits.
On your VJ.
Yeah, it's not fun.
Imagine going swimming in the
I
ocean
don't want to. I'm good.
while you still have that netting stuff in your swim trunks.
Oh, yeah.
Like
I
that.
cut that out.
I know, all smart guys cut that out. But I've been around a guy who didn't, and it was unfortunate for him.
Yeah, that's just something for your wiener to get caught in when you're in the ocean. It's horrible.
I think it's funny when people scream, I can't breathe. Where's that breath they're using to scream? Yeah. I say, when I couldn't breathe, I had this really nice nurse, and she knew I was panicking. I think part of the reason I couldn't breathe is I was panicking and just like hyperventilating. So she sat with me and she...
Deeper. We got this.
Because she had medicated me and they put on my fentanyl patch like I get it home, but those take 12 hours to kick in.
Oh.
So then they come back and give me some morphine because it hurts so bad to breathe. And even when I was breathing, I wasn't getting a full breath.
Mm-hmm.
And she just sat with me for like an hour and I'm just sobbing and hysterical. I'm like, I'm dying. I am absolutely sure I'm dying right now. She's like, you're not dying. You're okay. You're in the hospital. I was
Yeah.
like, yeah, but I'm dying.
That's what I like.
She was
Right,
very
like-
sweet. I probably should have asked for some Valium.
Oh, yeah.
That probably would have been because I was absolutely panicking. I probably should have asked for some Valium.
Yeah,
Oh.
but where was she? She should have asked for some Valium. I'd been like, she's freaking out.
Yeah,
some Valium.
I'm not sure if she knew I was freaking out or she thought
How do you not know that you're freaking out?
I was torn between, can I really not breathe this bad or am I panicking? It was really hard to tell. Am I actually suffocating or am I terrified?
I got Klonopin from my lady who was like freaking out. She thought she was having a blood clot. It wasn't a blood clot. It wasn't red. It wasn't shiny. It wasn't swollen. It just hurt really bad because she'd let her pain medicine lapse. And I was like, hey, so I'm going to call the doctor, even though you're not my patient, and we're going to get this fixed. And I was like, I need something better for pain. I don't care if it's a one-time order. I'm not getting off the phone until you give me something for pain and something to help her calm down, period. He was like, well, I was like, no. It's 9 o'clock at night. I've got at least 9 more hours. How much time do you have to sleep? Like, I'm awake. What are you going to do?
That's terrorism.
That's awesome.
It is. It's absolutely. I will go through those lengths for my patients. I don't care. I'm like, do you need to sleep? I feel like you do. I don't. I'm up.
That's the kind of nurse you need.
I just do that for fun.
Like I said, I specifically want the nurse in the back that chain smokes so much her hand's yellow and calls me hun in the gravelly
Hey
voice.
there, hun.
That's the nurse I want.
You need some Klonopin?
Yeah, that's...
Hey, sweetheart.
Yeah.
After you get out of here, we can go hit the nickel
And she
slot.
sounds like Janis Joplin. That's the nurse I want.
Yeah. I'm getting there. I smoke.
It takes
I'm
some
getting
years,
there.
but
Yeah, well, eventually I'll be that.
Julie says I got 6 stints and only peed myself once. Well, good for you.
Right? Look.
Well, good for you. Good for you.
Get an old people cookie.
Is it extra soft?
It's a soft cookie, so you can chew with your...
It's the same thing as one of those nasty
You can
baby
gum it?
cookies. They just gum it for like 4 hours.
So what's your take on addicts who have pain? Or former addicts. I
Yeah.
mean, someone who's been clean for a while that comes in. And is there any way they can word that? I know it's rough because you don't want to...
Well, and the hard part of it is that they
She doesn't
know
want to give up her
themselves.
secrets.
No, they know.
The secret code word.
They know
Charlie
themselves.
sent me.
That's hilarious. No, and they know themselves. And honestly, being really honest, saying, "Hey, I've been addicted to these before. I don't want to get addicted again. So if you can give me the least amount of medication that will help me get through this pain, I would really appreciate it." Just being frank and honest, and just saying, "Hey, I have no interest in doing this again. Like it took a really long time for me to get over this. I just want to not feel this much pain anymore." I feel like that's probably one of the best ways to do it.
That's what my mom's nurse does. That's effective nursing. I did Sarah have it hid under the bed. Look, I only hide snacks under the bed.
Yes. Yes, you do.
And only because if I don't, someone eats them. I don't know who that could be, but...
An animal cookie. It's frosted animal cookie.
I ate the last 10 that were in the bag, and that's the only 10 that I got
After
out
he
of
said,
that bag.
I bought this bag for you. But anyway...
Except for those 10.
Who eats a goddamn family-sized bag of
Me.
cookies?
Me.
Well, you know what? You have more medical problems than,
The animal cookies were fixing that.
CRPS.
I was medicating them.
right. Medicating your fat ass.
You're fatter than me.
I know, but not from animal cookies.
Well, except for those 10.
Yeah, I had a friend who passed away last year. She was currently an addict, and she went in and she was shooting up, so she had cellulitis, and they had to remove all the skin right here, and it was nasty. You could see her bones and everything.
Yeah.
Well, they were refusing her pain medication because of her status as a current addict, so she had someone sneak her in some heroin.
Yeah.
But then, right after they brought that in, the doctor said, "Okay, you can have some Dilaudid," and she didn't say anything.
And that's how she died.
Yeah, that's how she died. So
Yeah, you should always tell your doctor if you've done some kind of drug. I was reading an article the other day, and now that marijuana is legal, the amount of deaths is going up of people going into anesthesia.
yeah.
Because that is like one of the few things that THC will actually interact with is anesthesia, and you need to tell the people won't tell their anesthesiologist that they've been
Well, and
smoking marijuana.
I know this girl was
'cause
just
they don't know any better.
terrified to tell them because they'd already been refusing her meds. So she says, "I did this."
Yeah.
Then they're back to refusing her meds. And I'm not saying she's innocent in all this. Obviously, she did something stupid. But she had called patient advocacy. She had done all these things, and they just weren't getting to her.
Yeah.
And I mean, she literally has half her skin gone.
Yeah.
It's frustrating, but I know it's also hard from the other end.
Yeah, it's easy to empathize. It's easy to empathize with the fact that, like, look, she was trying to do the right thing in the first place, and it
Right.
wasn't working out, so she took matters into her own hands. That doesn't necessarily make it right, but it is at least understandable.
And that borders on cruelty. Anytime you have to peel skin off of a person. But the thing of it is don't be afraid to fire your doctor.
Yeah, that's the other thing I'm trying to get across to people. They work
Fire
for
your
you.
doctor. That is, yes, they're getting paid because you are there.
Even if you're in the hospital, you can request another doctor.
Yes.
They've
know
only
how
got
many-
one hospitalist on staff. Call somebody
Call
else.
somebody else. You can, I mean, I don't know how many internalists that we had, and they would get fired because they didn't agree with what they were saying. Hey, she called me fat. Well, I understand why you would want another physician.
Terry says, I have a past of using drugs, so I thought I would be honest with them and it would be good. I was so wrong. Every time I go in, I'm a pain seeker. Yeah, I confess to my daughter's psychiatrist one time because I was talking about ADHD medication that I had a history of addiction, and he refused to write my daughter prescriptions if they were going to be in my house.
Wow.
And I was like, but she needs them. I've decided that that is something you absolutely do not tell your doctors. Now, if you have a drug on board and it's going to kill you,
Yeah.
you kind of got to roll the
You got to.
dice.
Well, and that's the thing too. It's all about how you present it. If you go in there saying, "Yeah, I took 3 drugs," and you've only been clean for a short amount of time, that's not going to be helpful. Yes, they're going to treat you like you may or may not need this. Like, what is going on with this? Are you just getting it to sell on the market?
Yeah.
And that is rough. That is something that it's hard to know. But if you've been clean for 10 years,
Yeah.
you know, it's all the way in which you present it, especially if you're going in and saying, look, I'm hurting really bad. I used to be addicted to drugs. I don't want to do that anymore. I don't want to go and be on meth just to get away from this pain.
Yeah.
I want to fix it. I feel like they would be a lot better towards you. And if they're not, again,
Fire your doctor.
fire your doctor.
And I mean,
go to a different hospital. Whatever
Straight
the
up,
case
I
may
would
be.
tell them about that because there is nothing, I would not be willing to throw myself back into that. Because it's
Yes.
miserable. But I can understand why it's difficult for them. I mean, even when I was just volunteering in the ER at JPS, you get the same dude in there every day,
Yeah.
has the same thing every day, and it gets frustrating. It kind of beats you down because you're taking care from other people.
Mm-hmm.
Eventually, we figured out he just wanted a bed and a meal and some clothes, so we started just doing that instead of him taking stuff up.
Yeah.
But the homeless population uses that hospital frequently.
As a 3 hots and a cot.
Yeah. And it just, you don't want to say screw off because what if that's the day? What if that's the day they're having a heart
actually
attack?
having a heart attack.
Yeah.
Or a stroke.
It's impossible to know. And when you've been working there a while, you do get jaded.
You do. I mean, it's hard. Again, your bullshit meter has to be on point. It just does. You have to know whether or not this patient is actually showing signs. Check on them frequently. Go in there and see how they're doing. Talk to them about what started this pain. Make sure the story makes sense. And if it makes sense and it's reasonable, do what you have to do. Start off at a lower level medication before you get them on something heavy and see if it works. We're going to try this because this is what's ordered, and we're going to see if it works. If it doesn't work, I'll call the doctor and see if we can get you something a little bit better.
The other thing my mom told me is because I have the habit of getting on my phone to distract myself.
Yeah.
She told me put down the phone.
Put it down,
because they're paying attention to what you're doing. So if you go in there and you're really in pain and you're like me and you want something to distract yourself, stare at a wall. Don't look at your phone. Put it down. I mean, text your family and make sure you know, let them know what's up.
Let them know what's up, but then, try to bring some like headphones or something like that and listen to music. Do something
Or
that's going to...
throw the phone at the doctor.
And then you have a
Nobody
broken
likes
phone.
Yeah, nobody likes
No,
that.
broken.
And if you're stuck in the hospital for 10 days, you're damn well going to want that phone.
Yeah.
There is no place more mind-numbingly boring than any floor besides the ER in a hospital.
I wouldn't know. You always ignore me when I come to visit you.
Because I don't like when people come to visit me in a hospital.
I know, but you'd think if it was so boring, you'd actually care that people show up.
Well, and when you came up there, that's when I was on enough morphine that I was trying to color a coloring book that
It's
Ashley
fine.
gave me.
I mean, I just
and
stayed
kept-
up there like 3 days.
I kept
It's
passing out and coloring the wrong things, and I'd wake up.
And you're like, damn it.
because the one arm was in traction, so I'm like, It was so funny. I look at that page and it's just colored all on the corner. Because the nurse would come in and she goes, "That pain medicine working?" I go, "I don't think it is." And then halfway through that sentence, I just, there it goes. Later.
Thanks, bunches.
The funniest thing I did to a PT that was caught doing crack. I picked the pipe up and threw the drugs into the sharps container. Yes, take their crack pipe. That's. I can't imagine taking that into the hospital.
Brazen.
It seems like that's a good way to get it caught. What are you doing? What am I doing?
Not being on frame.
Oh my God. What would you do if you were a nurse and you caught a patient with a crack pipe?
Crack pipe?
Yeah.
Do they have enough for me?
No.
No. It's like a one-hitter.
Crack people don't share.
I don't know.
I don't know. Do you ever just call the cops?
I mean, a lot of the hospitals have their own security or whatever in there. The big hospitals.
Yeah, JPS had its own security.
JPS
I just watched
So,
a
like, police
viral
cars.
video lately, recently where I guess somebody was a cancer patient or whatever, and they were smoking
Oh,
weed.
they shook down the room, yeah. But that's because someone else called and said they were smoking it.
It was someone on staff.
Oh.
And the
It was just
doctor,
pretty shitty.
the
but-
doctor came in and said, "Don't y'all need a warrant or something?" I said, "No, it's not that kind of thing. You're in public, blah, blah, blah."
Yeah.
And the cops, you can tell, don't want to be there.
Because the guy was like 90.
Yeah, and he had pancreatic cancer.
Yeah, it was like the death sentence. It was like, here
Yeah.
you go, you're gonna die. I
And
don't
you
know
can,
when.
and I'm kind of torn because you can hear the guy behind him going, "Look, they got to do their job."
Yeah.
And on one hand, I'm pissed off for the patient, but on the other hand,
If you're smoking
Oh, I'm not-
in the
he was taking
hospital-
pills. Turns out he wasn't smoking it. I don't know if someone had some sort of vendetta or they, but
Yeah, that's
he had taken pills.
Somebody might have made an honest mistake or something, and like didn't you don't know what the story is leading up to that. But no, I wasn't mad at the cops because they weren't
They
mean.
had to check it
They
out.
weren't mean, but they got called to the scene of, a call, and they had to finish what they were supposed to. So they were performing their function. The guy even said, he's like, "Look, we're just searching all this stuff. If we don't find anything, then there's no problem or whatever." And I think they asked to search like some bag, and he said, "No, you don't have a warrant for it." And they're like, "Okay."
Yeah, basically.
But everybody was really pissed off at the police officers, like in
Yeah.
the comments and stuff. It's like, man, it wasn't the person you need to be pissed off at is the idiot that called the cops.
Yeah. But unless you're smoking it. And that's the thing. If it's pills,
Oh,
I understand.
Terry says she read the backstory. He was taking Marinol.
Marinol is legal.
Okay, he has stage 4 cancer. So
Yeah,
yeah,
but
he was.
honestly, though, then you need to have it on your script list, and the hospital needs to be giving it to you.
I think if you have
What's
stage 4,
Marinol?
Marinol is the liquid pill form.
Yeah,
of-
okay, because that's what he said he was taking.
Yeah. And it's something that we used to give in our rehab facility. Helps stimulate your appetite, and it helps with pain as well. Yeah.
That's interesting.
It was definitely one of those like in the fridge locked ones, and you had to count it with 2 people.
Yeah.
If I have stage 4 cancer, man, I'm doing cocaine, crack, heroin.
So say if I ever get stage 4 cancer
Okay.
or I end up in a wheelchair, what I want all my friends to do is just shoot me up with heroin every hour. If I die, I die.
That's expensive.
Yeah, I don't care.
Heroin's cheap.
Yeah, heroin's
Is
cheaper
it
than the
really?
meds I take.
Oh, yeah.
You know how much a Percocet is on the black market right now? $15.
A pill.
Not that you would know that.
I have friends that buy drugs. I need mine. I need my pills. But they like it was Dr. Dang that was running like the whole black market in town because he was just prescribing them for cash, and so they were selling them on the black market. So when he went away, the black market in town dried up.
Yeah.
So people are offering enough money to get people who they're trying to get people who need them to part with them. And most people are not doing it because, if you
need them, you need
Yeah.
them. You're like, I don't know what tomorrow's going to be like.
it's like, I already think the doctor doesn't give me enough meds. I'm not giving mine away. I'll just stay broke. Fine by me. But yeah, people have lost their minds. They are so expensive. And I'm pretty sure heroin's cheaper. I don't know, though. I don't know if Cleveland has any sort of heroin market. It's more of a meth town. Got a lot of cooks.
I can get you heroin before the end of the show.
Prove it.
I'm gonna have to make it. It might not be very good.
What is this? I found it under the sink and I cooked it. Well, sign me up.
He's gonna cut it with like Splenda.
Yeah.
I've got some chlorine tablets in there for cleaning the toilet. I can chop that up.
They use B12 car stuff for meth. The engine cleaner or whatever. That's what they use to cook meth. So, whatever. Yeah. I wonder if people ever sit back and think about what they're ingesting.
I know nothing about these things that you were talking about.
I have no. What?
We've all seen Breaking Bad.
That is not a very accurate show.
But it is pretty.
But 90% of how
they
I know
smoke
how...
their meth completely wrong
I know
on
that.
that show.
They don't want to give you instructions.
Heroin is extremely cheap.
Is it really?
But no one knows because you don't talk into your microphone.
Heroin is cheap.
She does too. I can hear her just fine.
Apparently, heroin.
Because you're in the same room as her.
No, I have my headphones. These are noise canceling.
Go away. Get out.
No. You get out.
Anyway. So how long have you been doing this?
Heroin?
Shut up.
The podcast? About 37 minutes.
Working in the medical profession.
I started when I was 21. Almost 12 years ago.
Nice.
Almost my work anniversary in June. Yeah, I started as a CNA, and then after about a year, I guess, 19 months, something like that, whatever. I finished nursing school, and I was on the floor for about 6 years on nights. They were like, Catherine, work on days. And I was like, no. Hate days.
I prefer nights.
Nights are the best. And if you got the one good nurse on nights, your night is going to go just fine. She's going to make sure that everything's good. Everything's taken care of. You got your pain medicine. And we can make a date for about 4.5 hours from now.
I like Halloween night at JPS. That is the best night of the year.
The only time I got to hang out in JPS was when I was doing my clinicals. And that was super cool. Because then we got to go play in the basement. And, run across the...
Yeah, I did that there, and we got to, let's go do a hot offload. All the students, let's go. Like, I don't want to get my head chopped off. Oh, that's not a thing that happens. But because my mom was charge nurse there when I was 13, I signed up for their volunteer program. Yeah. And most of the time they have you, delivering flowers and stupid crap. But Mom was like, no, let her do the cool stuff. So, yeah, it was awesome.
What kind of cool stuff did you do?
My first patient was a guy who... had passed out on train tracks and stood up and tried to run away while a train was coming, and it hit him. And they bring him in, and he's leaking blood, and it looks like Kool-Aid. They've pumped so much saline into him, but they can't pull him off the backboard. He hasn't had a CT yet. Well, he dies. They roll him over, and his spine and brain have been... His brain just thunk on the floor, and it was... The nurse in front of me turned around and says, well, guess I'm not having hamburger helper tonight. And I'm a kid.
Nurses are such dicks.
I'm sure I turned all sorts of shades after she said that. And that's when I realized that if they tell you to bring a face mask into the room, probably sack up and bring the face mask and don't throw up on the patient. But yeah, I got to watch them do catheters and all sorts of things. And I... got to help them rinse maggots out of old people that hadn't been taken care of.
Yeah. I had a patient come to me with maggots in there, and I was like, I can do a lot of stuff. I really can. I don't like bones sticking out that aren't supposed to be sticking out. I mean, if it's...
that aren't supposed... what bones are supposed to be sticking out?
Well, I mean, you know, your elbow or whatever sticks out like it's supposed to. Like your knee and such. But if it's out of your skin,
it's a compound fracture.
Fracture.
It's gross.
I'm not a fan. I will be like, that's not me. I'm not a trauma nurse. I had pictures of this guy who's his foot was off. It had this much skin hanging. The foot was just.
You wouldn't have liked when I got my foot run over by the forklift because the entire top of it was just open and exposed.
I could totally. I could see my tendons.
As long as the bone's still in
the
where it's supposed to be
where it's supposed to be.
They were kind of pushed over to the side.
Pushed over to the side is fine.
Julie says, Kat, do you have information on how to get different services? I'm not sure exactly what she means.
Yeah, it depends on what kind
of
different
a happy
services.
ending, you got to tip an extra $40.
Nurses don't do happy endings. Like, we touch enough penises as it is.
Oh, God,
Like,
yes. Oh, my God. Just wieners everywhere.
We walk in, guys are masturbating. Like, we don't care. We're
The
like,
funniest one I
"Yeah,
had
come
was the
back."
guy that came in and he was bombed. He had taken all his antidepressants and he's handcuffed to his bed, but he's shaking it so hard he's pulling. He's like breaking the side of the bed and he's trying to start the revolution in JPS. These nurses aren't taking care of us. So they decide to put him in the TB ISO room to try and shut him up, but then it just echoes through the whole place.
vents. Yeah.
So you hear the nurse come by and she says, hey doctor, can I give him a catheter? Because he can't get up to go to the bathroom. And the doctor's like, okay. And she walks away just smiling. I'm like, you just wanted to put a garden hose in his wiener.
Yeah.
But yeah,
Walk
he
in
was
with an 18 French.
It was less irritating before he started saying the N-word a bunch of times.
Yeah.
Then they got a little upset with him. And he's the two grabbed a nurse and pulled her down and said, give me pain meds. Like, don't touch the nurses. They get violent. That's the scary part.
I had this guy that he kind of had some chest pain, and I was like, well, when's the last time you had your pain medicine? Let me give you some pain medicine. I called the doctor just to make sure, like, hey, he's having chest pain. I gave him pain medicine. We'll see if it resolves. And he's like, I think he's had it before. I think it's muscular. It's not heart related, blah, blah. Well, he wanted Benadryl. So he's willing. I was like, go to bed, relax. You're having chest pain. Maybe go lay down. So he wants Benadryl, and I'm on the phone making sure he's not dying or whatever. And I walk back in, and he's like, how long does it take to get a Benadryl? All, like, angry. And that's, like, my trigger, apparently, because I was like, close the door, because there's family members out there, and I don't want them to hear what I'm saying. And I was like, look, I've been on the phone making sure that you're not dying. I have 9 other patients to take care of, and I haven't touched not a one of them. So here's what we're not going to do. You are not going to talk to me like that ever again. Do you understand me? And he's like, well, but
don't make the nurse scary.
Understand me?
Don't
Right?
make the nurse
like
scary.
total mom voice to this. I don't know how.
If
old
I'm ever
your man-
like in the hospital, don't let her be
Oh,
my nurse.
No, it's
sort
totally
of thing.
fine as long as
It's
you're
just,
not a
don't let
be-
the angel of death come back in here.
I had a
please.
Benadryl in my hand, and he's yelling at me. I'm like, no, sir, no, nah. So like afterwards, he's like, yeah.
Takes it in front of him. So, I got allergies too,
No.
bitch.
I totally went from "Do you understand me?" to "Okay, well I've got your Benadryl right here. Do you want a wet washcloth? Sometimes I know that helps to cool down your skin when it's itchy." Went total like opposite. So that I'm like, "How crazy do you think I am, sir? You don't want to find out, right?"
Julie says, like, rides to the doctor, home health care, how to get insurance to approve that.
Rides to the doctor. It depends on which area you live in, because there's MITS. MITS can help with rides to the doctor. They do have places like Nettie. I hate Nettie. And sorry,
I'll do it for
I hate
$5 in gas.
But they're Chisholm Trail. They're such sweet people. They'll take people to the doctor and give them rides. It does cost. I mean, just like a lot of times,
It might
if
be
you can
cheaper to
get
take
in
an
and
Uber.
out, this is exactly what I was gonna say. If you can get in and out of a car okay without having to do like wheelchair transport or stretcher transport, absolutely call an Uber. It's
Yeah, actually, I was at work
Lyft.
and somebody thought they were having a heart attack, and they're like, I gotta go to the hospital, and they're like, all right, we're gonna call you an ambulance. He's like, no, call an Uber. Please call an Uber. Please.
How to get home health care. I find that getting endocarditis works really well. I got some really nice home health care for about 2 months because of that.
Mina's on.
I mean, it depends.
How you doing, Mina?
Hopefully she's feeling better.
It depends on what you need it for also. Like if you go to your primary care physician and you say, I really would like just a couple hours a day home health care, and it depends on what you need help with. So if you're needing help like getting dressed in the morning, getting showers.
Yeah.
I need help with
she's a
showers.
baby. Shut up.
I
Gross.
do.
We'll get a nice
So
large
gross.
male nurse to help you with that.
It's fine with me.
Named Hans.
Yeah, I was thinking about you earlier, Mina. I hope you get to feeling better soon. I've had that same thing done, and I know it's full of suck.
Hans?
Huh?
What?
Mina is in the hospital.
Oh.
She's our friend that we outed earlier.
But yeah, I wouldn't know how to go about getting home health care for like showering and stuff. I've only ever had it like to deal with my PICC line
Yeah. No, and they do help you with ADLs. It just depends on what it is that you need. But you need to make it clear to your physician what it is that you're having issues with at home. So if you're getting like problems getting dressed, and there's home health agencies that go out everywhere. Terry, she works for like same kind of thing where they come and like sit with you.
Yeah.
But those are not usually covered by like insurance. The only ones that are covered by insurance are if you say, hey, I need 3 hours a day, this many times a week to get through A, B, and C. Mm-hmm. And that's usually when they would have orders for home health care and you can get it set up with them. A lot of the times you need physical therapy, but you're homebound.
Mm-hmm. Yeah, my mom had to do in-home physical therapy after her knee replacement, and her insurance paid for all that. Meanwhile, my insurance refused to pay for a wound care nurse after I had that giant hole in my leg. And I was just like, they were like, but you need home health. I was like, nah, my mom's a nurse. You know what? I got it.
So insurance is doing this really stupid thing. I don't know how this is even legal, but apparently it's like recently legal. But my insurance is set up so, like you guys were saying, like you fire your doctor, go find another doctor sort of thing. If I go to look for a second opinion at a different doctor than what I originally went to, they won't pay for the second visit at all. It's non-claimable.
Oh yeah, because your insurance is doing that thing where you have to call them and they hunt for the best price. They pick it out for him.
It doesn't even matter if I go to another in-network doctor though. If I choose to go to a second doctor because I don't like the first doctor's opinion, it's considered elective no matter what, and I'm 100% responsible for it.
What if you need a second opinion? What if a doctor writes it on a piece of paper? You need a second opinion.
That's a referral.
Okay.
That's different.
If you need you may go to the physician and they're not specialized in whatever issue that you're having. They'll refer you to like a neurologist or, or ortho doctor or something
orthopedic
like
surgeon,
rheumatologist,
whatever it is that you have an issue with that they're not specialized in. But if you have to have a second opinion, most of the time you'll have to call, like if you have insurance like that, you'd have to call your insurance people and say, hey, this is what was said to me. I don't agree with what the assessment was, the diagnosis was. I would like to go get a second opinion. Do you have any other people in network that you can?
Yep, I did that. You know what they said?
They still what?
They said, fuck you.
Nuh-uh.
Yeah, no, they don't. They really don't care. So the way my insurance is...
What do you have? Yes, get the card out. I want to see.
I'll get it for you in a second. But basically...
Because I specifically have Walmart Aetna.
So before I go to the doctor for any kind of procedure, other than like emergency medical stuff, like if I go to the ER or something like that, there's a number I'm supposed to call, and I'm supposed to tell them all my medical symptoms first. And then they shop it around.
That sounds shady as hell.
It is. It's bullshit. It's stupid. I don't like it.
What if you don't?
It's only barely legal.
What if you don't know how to express all of your symptoms that you're having?
Why is it any of their fucking business what my medical condition is? Their only job is to assess it after the doctor has sent them a bill.
That's true. I don't know.
And it's also stupid the way they evaluate what, this is necessary, this isn't necessary. You're not a physician. You don't even have a physician look at it. The physician said it was necessary. Pay the bill.
Well, that's why Abacare got so mad after he said I needed the tubal ligation because if I got pregnant again, it would make me really sick. And they said, no, that's a birth control procedure. We won't pay for it. I watched him argue with the insurance company, and they would not give. Yeah. And he was mad. He was cussing. I'd never seen him cuss before.
Because a lot of our physicians will do like a peer-to-peer. Mm-hmm. So they will call the physician on staff, I guess, for the insurance. I don't know. I guess that's how that works, is they call the physician on staff for the insurance, and they'll argue the case on why they needed whatever procedure or needed to stay longer in rehab or they are appropriate for skilled nursing, whatever the case may be. And they will talk to the insurance company directly. And a lot of the times that gets a lot more apparently not that one, though.
Aetna had been accused of not actually looking at those things when people...
Yeah, they're just putting them on a shelf.
And someone had come out from their company and said, no, we don't read those.
We don't read what?
Like appeals to get stuff done.
So the way they were getting around, the reason they didn't get just so completely buried in lawsuits because of that is because what they were doing is they were putting the burden back on the doctor. So it's supposed to be reviewed by a nurse before it's submitted to them. And it's actually pre-reviewed before it gets to the insurance company on whether or not it's going to get passed.
I remember with the spinal cord stimulator, I put in my request to Aetna because they had said no, and I said, this is why I need it. It's going to be cheaper for you technically, blah, 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 blah.
In the long run rather than surgery.
They said they do it. and I got the surgery done, and then I went back to the doctor the next month. He was like, "Oh, sorry, you owe $37,000 to come see me because the insurance bounced that." Like, well, but what?
They already agreed to it.
I don't
But
understand
they
how
go
they
back.
do that. Because once they give you approval and you have that off number, you should be able to. I don't understand how they can
I
just
called
be
them
like,
so many
Because
times.
it's a crooked racket.
that's ridiculous.
But I know Aetna and Walmart Aetna are different because
Yeah.
most doctors take Aetna, but a lot don't take Walmart Aetna.
Yeah.
Well, because they're the biggest. They're the biggest retailer in the world, like as far as what they bring in. So they have the leverage to put, like they do it on my company. They push back on companies. So, like if Target just like if Target wants to carry this light or whatever, they'll call up the company that makes this light and say, we want to order 500 of them. How much are they? Blah blah. Walmart will call them up and say, well, we don't like that price. How can you make a cheaper version of the same thing that we can sell under this? And they get away with that crap. And good, I'm not wearing my work shirt. The company I work for that makes things for Walmart, we make a crappier version for them that is like way cheaper. They do the same thing with their benefits and everything they do. So they get like with their truck drivers, they get these bargain rate truck drivers that are on their
Good to know.
Yeah, with their insurance, they do the same thing. They went to Aetna. They go, no, we're the biggest employer in the United States. We want a cheaper rate. How can we do that? Oh, well, if we cut all these corners and you can only see 2 doctors in the state.
As I say, because for a while they cut Texas Health, Harris
Yeah.
completely off my healthcare. I was like, but
There is
the
no
only
one
place I
else.
go.
Great, I can go to Baylor
the closest
and
Baylor's in Fort Worth. I live in Cleburne. It's only THR. What do I do? You drive to
Yeah.
Dallas and go to TU.
You go to Mexico and
UT. That's where I went. I
get
went
drugs
to
out of the back of a van.
I went to the university hospital after that, which ended up costing them a lot more. Because
Wow.
F them.
The only insurance that I know that really sucks as far as providing benefits for our patients is Ambetter.
I haven't heard of that one.
Ambetter is the Obamacare. You
Oh,
can't-
the marketplace. Yeah, the marketplace.
They don't
insurance.
give you anything. They don't give you equipment, which is really hard whenever you're non-weight bearing and you're trying to get a wheelchair to try to function at home, which sucks. It takes them a really long time to do it.
I know with trying to get on disability, a lot of people are pushing me to try and get on Medicaid or whatever, too.
Yeah.
But the problem is there's no pain doctor for
On
like 6
Medicaid?
cities on that. The closest one's Fort Worth again. And it's hard, and I know a bunch of people that see the pain doctor and they've just had a really hard time getting there and back. People that are worse off than me. I
Yeah.
can drive, but some of my friends that are sick can't. And it's just really frustrating. Doctors in our town don't seem to want to take it.
Yeah.
I guess it sucks. I don't know.
Well, if you have Medicaid, do you still have that secondary?
See, I don't know. I guess I don't know all the rules with that yet. I was just thinking about it. I honestly don't want to go on it. I mean, I'm insured. It's better than that. It just has a $26,000 deductible, whatever.
Well, and I do know the friend that I was trying to get on here actually, because she's got chronic illness. And she doesn't have a job. She doesn't have anything. She's on state paid benefits. She's on disability, so she gets her check for food. She gets her check for living, and then she gets to see whatever doctors. I think she sees a rheumatologist, a neurologist. I mean, she sees a lot of different people. Of course, she's in like the Justin area, so nothing's too far.
Yeah.
But it's still a drive, and she still has to make it to her own appointments, and she still has to get. The only thing that she runs up against is if it's something remotely elective, is it killing you though?
Yeah.
Then they're like, maybe not. Maybe we don't need those IV medications that this doctor is trying to put you on, and that is frustrating. But then again, she doesn't pay for anything.
Yeah, that's kind of the
She
toss
goes-
there.
Yeah, she goes to see an MRI. She goes to get an MRI. She doesn't have to pull up front. She doesn't have to try to pull wads of cash out of her ass trying to get this MRI done, because those usually up front,
Yeah,
if you
same.
haven't met your deductible, it's
That's one of the things with my insurances. They're like,
$100.
if you call this number, you can get an MRI for $1,100, blah blah, instead of the $2,500 or whatever they charge at the hospital. And I'm like, and the company, when they send you they're like, call this number first because you can save a lot of money. You're like, no, I'm not saving any money. You're saving the insurance company money until my deductible's met, because this is bull crap.
Well, that's what my doctor offers, self-pay for like $60 an appointment, whereas with my insurance it costs me $130 appointment. But then that money doesn't go to my deductible.
Right. And you got to think about the fact that, okay, you pay X amount in premium every month. And yeah, okay, it's technically cheaper to pay the out of pocket, but then you're paying your premium plus that. And that's why I propose that somebody put like a law that says if your medical expenses are less than the premium that you pay in a month or a year or however it divides out, then insurance should have to cover it if it's less than the premium, because they're still profitable.
I say, because I need an MRI for what's going on with my leg, and I haven't told the doctor because I know he's going to order one and I can't do it. It's like physical therapy. He keeps trying to get me to go to physical therapy, but it costs me $70 an appointment. I can't pay for that.
So somebody that works in the medical field, how would you feel about universal health care? Like, I know you think currently insurance, it's not great the way it is now, but do you think we should go from
and when
away
I
from
say
an insurance
universal health care, I mean like Switzerland, like the countries where they've made it work.
And then that's the thing that scares me, is that the U.S. is so based on greed. It really is. It's based on how can I get mine fastest as I can. And then once I get mine, screw everybody else. And I really see them I see them trying to rebuild the wheel. Instead of looking at countries who have figured it out and figured out how to be fair to their physicians, how to be fair to their clinicians, I would be super scared of that, because U.S. is haughty.
Because we don't want to emulate anybody. We want to be like, no, we can do it better.
Pioneers and do it on our own, and that's ridiculous. Whenever you can just emulate other countries and see, and then absolutely mold it to what you have and what works for your country. But this make it kind of your own. But start with those building blocks that other people have forged through first, so that way you're not making the same mistakes that they've done. I mean, I feel like that we're not going to be that smart, that we're not going to do that, and we're not going to invite the greatest minds, brilliant minds to come help us do that.
See, I'm all for universal health care. I feel like there's going to, if say somebody we want gets in office and says, okay, this is what we're doing, and they get the votes passed, what they're going to make the mistake of like just trying to flip a switch,
and do
make
it overnight
work.
instead of,
and it's going to be like worse. That's what happened with the ACA. ACA was a good idea, but they
gutted it.
They gutted it, trying to force it through so quickly instead of saying, okay, let's make an 8-year plan to get all the kinks ironed out.
Now.
Yeah.
And now we are where we're at. And see, the thing is like next year is going to be the first year you don't get penalized for not having it. Having insurance. And like I'm at the place I pay so much in premiums and crap that don't get used. I'm actually considering, can I roll the dice for a year and go without insurance again?
My frustration has always been down to this, and people think I'm taking it to the nth degree, but I'm really not, is should I have to die for being poor? It's a basic question. Do I deserve to die or be miserable sick on a daily basis because I can't afford my meds or to see a doctor? And that's what it comes down to for me. People are like, well, it's not that extreme in most cases. No, it's not, but I'm living this life.
Yeah. Well, and a lot of people, they have like JPS connections and things like that. That's a little bit more affordable.
Yeah, back in the day, when my mom worked there, I could get insurance through there. But since I don't live in Tarrant, I can't get it.
That sucks.
But as if I want residents operating on me ever again. But
I think it's like everything, though. I think everything is a case-by-case basis. Like in your case, poverty can freaking kill you because of that, if you don't have insurance. In other cases, it isn't so extreme, so it seems like a more ridiculous argument. Yeah. And so
it just doesn't feel ridiculous to me, and I don't like being accused of being you Chicken Little, screaming the sky's falling.
I see the one side of the argument is like, well, I don't want to pay for everybody else's medical care. Well,
but why not?
But don't think of it that way. Is kind of what I'm getting at.
I'd love to help other people get medical care. That's what I don't understand about the way people act. Is if I had the excess resources, I would love to help other people.
Well, my point in it is I don't think they realize that they already don't. They're already doing it. You're not losing any more money.
They overcharge. They overcharge.
God.
But what were you going to say?
Hospitals are ridiculous. No, and like Germany, they have a really stupid high taxes. I mean, stupid high taxes. They pay for everybody. Everybody pays everybody for everybody.
It's like a 50 to 70% tax rate.
It's really stupid high, but everything else is so cheap.
Yeah, everything's covered. The thing is,
everything is super cheap.
In Norway,
The food is super
where they
cheap.
have a
Everything's super
70%
cheap.
tax rate, it's one of the most expensive cities to live in. But everything else is covered. They don't have to pay for healthcare. They don't have to pay for school. They have people come and take care of their kids for free so they can work.
And the rates don't move around a lot. Like in the U.S.,
It's static.
year to year in the U.S., tax rates change 10 to 15% for every bracket. So something is always going on here. But we want to point at countries that have these like ridiculously high tax rates for all their socialist things.
Their welfare state, yeah.
But it's the rate stays the same as comparative to their incomes.
Yeah.
And it's like they're never losing out. Yeah, you're paying this big chunk to this thing, but these are things you would pay for out of pocket if they weren't provided as part of like the living package for being in that country.
The problem here is, so if you're on the lowest end of things, like if I was a little poorer, everything would be okay. If I was a little more wealthy, everything would be okay. It's that I live right in the crack.
Right smack in the devil.
Yeah.
Right where everything
You
falls
live where
in the ass rape portion of it?
yes, exactly.
Yeah.
The ass rate portion of the tax bracket.
Yeah, where we make just enough money that they're like, oh, no Medicaid for you.
What I was going to say is you live where the middle class used to exist.
Yeah.
We don't have a middle class anymore. I mean,
I would have been middle class 30 years ago.
Yeah, I'm middle class, but by a lot of standards, people are like, dude, you're rich.
Yeah,
like,
you seem wealthy to me.
Yeah, it's like, hey, you have a house that you're not worried the bank's just going to take tomorrow.
And then your fridge broke, and you were just like, and I got a new fridge. And I was like, how do you do that?
Like, and a new dishwasher.
I've been eating out of an ice chest for a month.
These are just things that like were understood when we grew up. It's like, oh, your thing broke and you don't really know how to fix it. Okay, buy a new one, and that's just.
Well, and
like,
people
normal.
dog on me because they're like, well, but why did you have kids if you were so sick? I'm like, you idiot! I made good money until I got sick.
People think if you're poor now, like you were always poor.
Like I worked in the medical profession. Like I got a nice shift if it was.
You weren't
good.
as sick either
I
before
know.
you had kids.
No,
She
it was
wasn't sick at
it was
all.
the second kid. Yeah, I was healthy before I had the first kid, and then the second kid is kind of 2 years after I had Andrews when I crushed my hand.
This is the same country that came up with the phrase "shit happens," and then they forgot that. Oh yeah, shit happens.
Pull yourself up by your bootstraps. That's the one I love. Well, my mom, they always have that story. Well, my mom had brain cancer and she was still able to work.
Well, I just like the backwards thinking of like.
She should have had to.
I just like the backwards thinking of only lazy, uneducated people are poor. I know
I'm definitely uneducated, but
I know people that have bachelor's degrees that work under me at my company for like $2 above minimum wage because they're like, "Hey, bro, this is all that's hiring." I'm like,
I'm right. Well, do what you got to do.
Yeah, I know.
Now.
I'm like, can you drive a forklift? I'll fucking learn.
you know, it only takes a semester to get your EMT. Just by the by.
But still, but there's knowledge. If you had gotten knowledge. You had probably more knowledge at the age of 13 running around with your mom at the
She took my
hospital.
blood pressure yesterday. I bought her a blood pressure cuff and
Do you check your blood pressure?
Me, no.
What?
Because my blood pressure usually runs about 90 over. I'm low. The problem I've been having lately is standing up and getting dizzy. But I know I run about 90 over 60 most days.
Remind
I've never
me not to put any hibiscus in.
I say I've never had. The only time I ever have high blood prure is, of course, if you're having
extreme pain.
Yeah.
Oh yeah, I forgot her birthday present.
Oh yeah, you have a birthday present. But I don't know. Last night I took it and it was like 110 over whatever, so it was good. But
always whenever you're having and this is what sucks for you because there's good days and you're like, yeah, everything's fine, I don't need to check shit, and then there's the crappy days, and that's all the information that you have is what's going on in your crappy days.
Well, that's what I was talking to Brad about how I felt today, and he's like, I'm not really sure like why you're talking about all this. I was like, I'm trying to kind of journal it because if you're gonna make me tea or whatever, I want to know what I'm like now. So I'm gonna write it down,
and that's perfect. And honestly,
there's some good apps for that.
With chronic illness, you should be doing that anyways.
Oh, can I express to you how bad I am at even taking a medication on a daily basis, even if I'm in pain and need it?
And you couldn't damn well know it. You do. You know this. You know that
She doesn't
you should.
need to log it because if she's feeling shitty, everybody knows it.
Your mom's a nurse. No, everybody except the doctors that are trying to treat her. Your mom's a nurse, and
Are you
you know
saying
good
I
and darn
whine?
well that this is
What?
what you're supposed to be doing.
Are you saying I'm whiny?
Whiny?
Julie says those same people that want to know why you had kids are the same people that are against birth control. Yeah, statistically.
Yeah, most of them.
Like, well, I could have gotten an abortion. Well, no, not that. It's like, I'm joking. I love my kids.
It's never too late for an abortion.
Mostly I love them, except for the other night when Caitlin was having a sleepover and our electricity went out and they'd been watching horror movies for the past 6 hours
that's
with my
fun.
8-year-old son. And everybody lost their minds. And it was out for the next 16 hours.
That's great.
Fun
Wow.
times.
How was your food after that?
I didn't check.
Oh.
I came over here and didn't want to deal with that. You asked my husband. But no, yeah, I tell everybody that they need to log and they need to keep files, but it's something I am tragically bad at.
And here's the problem. If you have something like that where it's chronic illness, and this is what I was on a good day, this is what I was on a bad day. If you bring in trends like that, the doctors will respect the shit out of you. They will talk to you like a normal human being. They will ask you questions about your care. They will ask you about what works for you, what doesn't work for you, and they will treat you like you're not a frequent flyer because they'll see a log of your chronic illness. My friend has a binder, I'm not joking, like this thick, of all the MRI results, all the x-ray results that she's had, all of the diagnoses that they thought she had that one time.
Yeah, like my celiac disease.
All the ones that they're for real, you have this though.
Yeah.
All of those she has. I mean, it's pretty substantial. It's one of those 3-inch binders, and it is full.
I like what Harris has started doing where they hand out the paperwork after when you check out.
Yeah.
It's the vial of life or whatever, where it has all your I've got a paper that has all my diagnoses,
Yeah.
all my meds, and like whether there be ID or whatever, and all the stuff that I have issues with. I'm like, this is a nice thing to hand out.
Which is something that you need to bring with you every time you step foot in your hospital. And that's just the case.
I'm just trying to avoid the hospital.
You've done pretty good. You've gone a whole quarter.
I say whatever. Last time I was in the hospital was late last year with the arm thing. It was like
It starts over at 2019.
no, I'm counting it. Anytime I am I go more than 3 months without a hospital visit, I count it.
Yeah.
Because for 10 years I didn't go more than 3 months.
So I should
without
make you a
hospital
punch
visit.
card?
No, I want a trophy.
Oh my god, that would be amazing.
Yeah.
You get your like 20th hospital visit free.
Let's say I think I get my next surgery free, right? I'm at 28.
You get a set of steak knives is what I hear.
I think at 30 I get a free one. Is that not how that works?
I don't know.
Oh, I thought that was like Starbucks.
No, they just bring you a free dessert.
That was the Mexican restaurant down the street.
So I think Brad wanted to ask you about the physical therapy stuff while you're here, and
I did.
You had talked about because she's good at like talking about how it can benefit people. And
I mean, y'all kind of already touched on it, but I was curious how much like you get, because I know you've been prescribed physical therapy,
Yeah.
but sometimes you've sought it out because it at times helps more than the medication, depending on what's going on.
yeah,
It may not help during
it doesn't
the
help
physical
my
therapy.
pain.
It depends.
But
and it depends on
without
what they do. Because physical therapy, everybody thinks that physical therapy is just exercising, stretching, and
Mostly
whatever.
it's painful.
A lot of it is, and they'll give you home exercises to do, which you probably won't, but you need to.
Oh, I did with my hand.
Good.
I still do.
Good.
Well, because of the
And you
way
should.
the way they did it is these scars and the one here, because I keloid. If I don't, it contracts.
Yeah.
So without physical therapy, they told me I would have lost the full use of my hand.
Yeah, well,
and
ditto.
so
Had to do my own
that's
physical therapy.
that's the one time I've actually kept up, because they started me the day after my surgery with the compartment syndrome.
Yeah.
They sent me straight,
Because they didn't want you to get any blood clots or anything like that in there. Yeah.
and it was a
have to-
Well, they were
specific.
borderline. They were on the edge of a lawsuit anyway. So.
Yeah, because they
Promote.
told me I didn't have compartment syndrome, because that's impossible to get in your hand. But I went to a place that did very specific stuff. Like they had a hand section, and
Yeah,
they did
we
a
had
lot
a
of really
hand-
cool stuff.
in outpatient especially, like
Corn
we had
husks.
a hand.
Yeah, because they threw heated corn husks at my hand. That was nice.
Flutotherapy. Yeah, so it's a desensitizer as well as it helps promote your blood circulation from the heat and everything like that.
Yeah,
It's
because
really nice.
allodonia is one of the main symptoms of CRPS. So wind blowing, anything touching it hurts. So part of
So
the therapy is to like rub
Extra
stuff on
sensory,
it. Yeah.
Yes. Provide
Which
extra
it's gotten a lot better over the years, because like when I first met you, I think I grabbed your hand one time. And no one touches my hand or what.
I think
and now it's like it's more
Yeah.
tactile. You're like, no, it feels good to rub my hand or whatever.
it's especially around the scars that get sensitive. But I know I need to do a CRPS episode, but specifically with CRPS, the patient makes the mistake of not using the limb, and then it
They neglect
degenerates,
it, and
then they end up having to get it cut off because the bone's rotting and you're getting atrophy, and it's no good. And I didn't want to go through that.
you don't want to lose your hand.
I do.
Speaking of, have you bumped your hand or something? It does look a little swollen.
Oh, it's
there.
just like that. But a doctor asked me once, and I thought this was a good question. He said, if you could go back in time, because he told me I'd lose the hand.
Yeah.
He said, if you could go back in time and not fight against that and tell them just to do it, what would you? I was like, I'd have them cut it off straight up. I would have a cool ass robot prosthetic.
Yeah, and that to me, honestly,
I'd just pick people up by their throat.
10 out of 10 pain. I'm serious. Like, if you would rather just be like, no.
Give it a vibrate function.
Oh my God, Brett.
What?
You're disgusting.
That would be, wow. You should
You can rub people's backs.
You
and-
should patent that. Yes, a personal
The
vibrator
vibrating
hand.
prosthetic.
You're the one that went to the bad place.
No,
But,
but like that's what every vibrator is secondary uses for.
But I was bad about, I went for my back, physical therapy for my back, and I had a really hard time keeping up with that. Is there any tips or tricks you have for helping people keep up with
With what?
physical therapy? Just to do it every day, to remind yourself to actually stick to it.
I mean, put it on your phone. Put it
Set
on your
alarm.
phone and set an alarm every time and be like, all right, here we go. And just do what it is. And honestly, whenever you're doing your exercises, they give you just the movements, really. Everything should be slow and controlled. Because you're actually getting the full movement, the full strength. You know, whatever it is that you're doing,
Yeah,
do
this
it
is one of
slow
mine.
and controlled. So that way you're actually engaging those muscles and you're stretching, you know, appropriately. Because I love rehab. I got to work at outpatient for a year as a day program coordinator. So they got to hang out with me for like the day and they ate lunch with me.
I remember,
like,
I really liked my rehab chick, but I remember the first thing she wanted me to do was she wanted me to be able to touch these two fingers, and she
Together.
wanted me to make a fist.
Yeah.
And I remember I went home that night and I was like, okay, I got to go back to rehab in 2 days.
I'm gonna do it.
And I did, and she was like, I didn't mean that fast. I was like, but whatever gets me done with this.
Yeah.
That's how I was with my foot.
Yeah, she just
Is
wanted it over.
they're like, okay, now don't put too much weight on it, but what you want to do is you want to walk a little bit and make sure you get that range of motion back. And they meant like over a month. I came back, I'm like, look, I can hop on one foot. And they're like, that's bad.
Well, she was
What
so
are you
funny.
doing? I'm like, I got to go back to work. They're not paying me.
She was so funny because I was like, look, I'm done with physical therapy now. And she was like, no, this is for the rest of your life. Ha, ha, ha. Oh, no.
Surprise!
Womp, womp.
Well, they tell me I have that clay. Like, it's different densities, I guess. Like, the colors rate to density, and I play with that. I keep it in my bag.
Yes.
But until my kids stole a bunch of it and rubbed it on my carpet, but whatever. I
The
bought
ones
a
with
new
the
pack.
that you can put the beads in.
I don't
and
know
pick
if you
them out.
can. I'll show it to you before you go. I
Yeah.
keep it with me, but
And you can always buy more on Amazon.
Yeah.
Amazon has a really good, cool stuff about like any kind of resistant bands are on there. A lot of therapy grade things are on.
well, and the PT place in Cleburne sells them out of a cabinet
I'm a nerd.
for like $2.
Yeah.
It's really cheap.
They come in like a giant roll for like the resistance bands that they use in therapy. It's like that's just giant roll. But even for the hand, they have those cool like things that you mush down on it. They have the different colors for the different resistance on there for your fingers that you can do as well. That you can
Guitar
just-
trainer.
You can just sit there,
I play
I just-
Guitar Hero.
squeeze on it and squish on it while you're watching Netflix or
Yeah.
whatever it is that you're doing that you're bored anyways. And
I
you're trying
really
to
liked
distract yourself.
the fine motor toy that you, like you're not supposed to touch the sides. Like this is.
That sounds a lot like what is that Operation?
An Uncle Spinny Dervish?
It reminded me of those things that kids play with the balls on them, and they like go
An
up
Uncle
and
Spinny
down.
Dervish.
An Uncle Spinny Dervish. I don't think that's a.
It is.
I'm gonna-
It's called an Uncle Spinny Dervish.
Somebody needs to Google that.
So anyway, to recap, if you're in pain, probably act like you're in pain.
well, but everybody acts differently,
Different.
and it's okay, but maybe not be chilling, sucking on a Sprite, eating Cheetos, talking to your bestie about like, and oh my God, this happened to me the other day. And like right now I'm at the hospital. Hold on, the doctor's coming in. Yes, I have 10 out of 10 pain.
What did I tell you?
It's an Uncle Spinny-Durish for real.
That is not the right one. No, in the doctor's office.
Yeah. I know, but she was talking about it's like the other
it's
thing.
like it, but you have like a circle around it. No, it's not that, but this is like those things, but you have like a circle thing and you're not supposed to touch the side. Anyway, probably don't go in and say you're allergic to opiates, but then ask for Dilaudid.
Yeah,
because that's an opiate.
A big no-no. But be honest and fire the prick who tells you that they can't give you pain medicine because one day, 20 years ago, you took drugs.
Yeah.
That asshole needs to go get another job. I'm sorry. That's not okay. If you've got an extreme issue going on right now, that is an acute pain event. You can use that word. I'm having an acute pain event.
No. Never use doctor words with the doctor, because then they know you've been on Google or some medical podcast.
I have noticed that if I talk to them and they treat me like a regular patient, like it's very frustrating. But the second I was an EMT, my mom was a nurse for 30 years, they switch.
They flip the script on you. As long as you have a reason to know these things and be like, I'm watching you.
So, I got the answer. Lie to your doctor.
My best friend.
Tell them you used to be a nurse.
Well, I tell people I'm hiring my mom out. Take her to a doctor's appointment. Yeah. She will get shit done.
Yeah.
She will get it done. And she knows all the doctors. She trains most of them.
See, and I'm not near that level of badass. I'm really not. But I can guarantee you that I'm going to wear this face and I'm going to come talk to you about why you're not giving my friend pain medicine after she's gotten 11 pins in her foot.
Yeah.
And if you have given pain medicine, I will give her a bath.
And the thing is we've discussed it a lot on this show, is so many people have a hard time standing up for themselves. They can do it for other people.
Especially if they're in pain at the time or sick at the time. Like you're not at 100% anyway.
You've been with me. I stumble over what I need to say. I can't get it out.
Oh, yeah.
Well,
I totally play ventriloquist.
That happens a bunch when you're not feeling good anyways. But, I mean, if you can, and you've said it a million times on this show, bring a friend, bring somebody, bring your mom friend, not your whatever friend that's going to play, Soda Crush in the corner and watch you stumble over your words, but that mom friend who says, no, honey, your pain is not a 4. I know it's not a 4 because the other day when it was a 4, you weren't acting like this. You're acting like it's an 8. That's what you're acting like.
It better be an 8 because I punched you in the face.
So many of my friends downplay because I went with Casey that one time and it was this whole big deal and I kept saying to the doctor, you got to do, because they were just blowing it off. And I finally stood up and apparently I turned bright red and I told the doctor that we needed a different doctor because he was unpleasant and rude and it was just bad.
Yeah.
But yeah, it was for some reason I can do that for other people, but when it's me, I need my mommy.
Well, and then a lot of and I just read or listened to something the other day is treat yourself like you would somebody you love. So if you're going to the doctor and you have to put your big girl panties on and go by yourself, which sucks. It really does. I don't care if you're a dude. You got to put your big boy panties on.
No, I wear girl panties.
Your strawberry shortcake panties or whatever. Whatever's you. If you do, just try to treat yourself like somebody else that you love. If you were taking somebody else to the hospital, would you have stood for what just happened in this room? Would you have let that go on? If the answer is no, get somebody else in there. Call the nurse and say, look, I don't appreciate being treated like this. This is what's going on with me. I really am having a hard time. Otherwise, I really wouldn't be here. I don't like hospitals. So if either you could get me another doctor or please pass along this message for me, I would really appreciate it.
And nurses are a lot better at listening and taking the time. I mean, because the doctor is all over the place.
Yeah.
They've got so much to do.
And to be fair, he's got a lot to do because he's the only one in the freaking building that can write prescriptions. He's the only one that can...
Well, he can sign them.
In the building...
Like where I go.
Well, okay,
yeah.
like a lot of the hospitals around us are like standalone ERs.
Yeah.
So yeah, there a lot of times there is only
There's like one doctor,
on.
2 PAs,
I was gonna
and
say,
then
but there's also PAs that can handle their light work. Don't get it twisted. He's not that run down that he can't spend 5 minutes in the room listening to you and being a nice human being.
I'm not completely defending. I'm just saying, but
Period.
that person does have a lot to do,
Yeah.
and they're depending on the information that they get from the nurses and stuff like that. So
Yes.
if the whole staff as a whole is kind of spotty, that's kind of what you're gonna get. Because I've had a mix of all the different things. When I used to go to the clinic over in Lake Worth or whatever, anytime I would talk to the either the nurse or the actual doctor there, it sucked. But there was this one PA, that would always listen to every single that took the time to listen to every single thing I had to say.
The pain guy, I see is a PA, and I love him.
Yeah.
But I'm always going to have a fondness for nurses, I guess because of what my mom did. But also, when I had compartment syndrome in my hand, the nurse took my doctor aside and tried to talk him out of sending me home.
And I think a lot of nurses forget whenever I don't know how long it takes or if they just never were supposed to be a nurse and that was just something that they thought they were going to make a lot of money at. That's not a thing, by the way. You never make enough money for all the things that you should be doing and to take care of your patient correctly. And you have to wear so many hats. But at some point, they forget that they are their patient's advocate.
Yeah.
And a lot of the times they're their only patient advocate. Their family doesn't have time to take off work to come do whatever event this chronically ill patient has going on at this moment. That's just not a thing. Your parents are working or, maybe they are retired, but they're going through their own health issues. It's really hard and especially with me, I work with a lot of elderly. Those kids are not even in the same state as mom. They don't know what's going on with mom. They barely know that she's okay, kind of off in the distance. Out of sight, out of mind. So, first and foremost, you are the patient advocate as a nurse. And people who forget about that, it just really bug and irritate me because it doesn't take very long to say, hey, can you just come here for a minute? Can I bother you for a minute and just let you know that this is really not okay? They're really having a really hard time. A, B, and C, and D are going on. And I don't think she's expressing it the way that, you would really be able to handle that or make that judgment call. But this is really what's going on. And if you don't have a nurse that's good enough to do that.
Yeah.
Fire your nurse. There's like 3 or 4 of them. They only get 6 patients.
Yeah.
They're busy.
Yeah. But
they're not your only choice. If you get Nurse Ratchet in there who's just like, what? You're fine. Go home. Right?
I like Nurse Ratchet.
well, because we're almost out of time. What? You have anything to?
I mean, just be honest. Be honest and keep. Gosh, I cannot express to you how much it helps because they don't. You think that all their like super NASA computers are all hooked up and linked up in the.
They're not. They don't know anything about anything that ever happened anywhere else.
I mean, the first thing they do when they come into the room is like an angel out of the Bible. What is your name? What are you here for?
Well, because I just remember THR sent me to another THR,
and they still had no effing clue.
Why are
about
you
what's
here?
going on? Yes. Nothing.
I see you came in on care flight. What is this?
Why are you here?
If you get transferred to another facility, make sure your discharge packet is with you.
They always transfer me. The last 3 times I've gone, I've gotten transferred every time.
They need to have an MOT and a discharge packet. If they don't have that with you, tell them I'm waiting here for my excuse me, sir, that nurse over there that was taking care of me, she's still waiting to print out because they won't fax it. They don't get time for that. No. They'll forget. So make sure you have your discharge
And apparently
packet.
hospitals don't have the internet.
They're not hooked up at all.
I think they're trying to go to like Epic to where it's more of like a universal
thing.
Well, I heard they upgraded to Windows 95, so...
Well, I forget. My mom spent like 10 years of her nursing career off the floor implementing charting software in hospitals.
Yeah.
And she was talking about how it was hard to,
And it's hard to switch from paper to EMR for sure.
Yeah.
And then now I think honestly a lot of the acute care facilities are switching to Epic, so that way it's a more universal. So that way whenever they do look up your name, if it's input the correct way and your social security number is right in the system, it should pull up all your stuff. But in the meantime, make sure you have all your information with you. Put it in a binder. It doesn't take very long to just
and
put
make
3
some
holes
sock
in there.
puppets.
I
So you
think
can
the one
act
she
it
was doing
out.
was MedHost, but I can't remember. It fell out of favor.
I think Epic just started. for moving to most of the hospitals. A lot of, I want to say like Harris and stuff like that, they have them. But they're all moving towards the same for acute care facilities. If that ever came to rehab, I think I would be really super happy about it. Just so that way it would all be integral. So that way, no matter what, if I'm looking you up, I can see what happened, 3 years ago and be like, maybe it's that part that's messing up this part over here so we can do better rehab. Knowing the full story instead of 84-year-old grandma trying to be the historian for her health care.
That is, it's
talking about
so much. It's too hard
to go get her baby, and her husband that's been dead for 5 years is gonna pick her up later. So that's really, but definitely. I mean, and when you're in pain, honestly, you feel like a dementia patient.
Yeah.
Who doesn't? You're like, I don't know, like maybe 2012 kind of.
The rule is always paperwork.
No, that wasn't 2012. That was 2000.
I do that all the time. Like, it was 2012 or was it 2010 or I just had my kids, so maybe it was. And I'm telling a story like Allie tells stories now.
Yeah, and it's whenever you're a nurse or medical professional, you're like, this is all bullshit, and she's just asking for pain medicine. It sounds really hinky. Yeah. So have your stuff together. If you're gonna ask for pain medicine or a care that's directly related to something that's happened to you in the past, then bring your stuff.
Any wrap up for you, sir?
Nothing. What I'm taking out of it is the old trick of like trying to hint around that you need pain medication rather than saying, "Hey, I'm in pain. I need pain medication." It's probably a bad idea because a lot of people are afraid to say, "I need pain medication."
I won't.
Yeah.
But probably. It's probably okay to say, "Hey, look, I'm in pain. I need something for the pain," but don't be like, "But I think it starts with a D."
No. I also have to remind them very frequently that I can get meds while I'm there. I can never take a prescription home. I'm contracted. I cannot do that.
Dude, the only time you get prescriptions is when you can't cash them.
I know.
They're just like, "Here you go."
I just got a pile of prescriptions that hospitals have sent me home with that I can't.
You can't do anything with.
I can tear this up. I'm taking my pain doctor.
And to me, that honestly speaks volumes to somebody who's like, rather than I'm just looking for something so I can go fill it and sell it.
Well, I'd get booted out of the red flag so fast.
But I mean, you could find another Sarah that has another scribble that looks like
it's
this.
So easy to doctor shop and all that stuff right now. But if they ever get their system straight, a whole bunch of junkies are going to be in a real bad place.
I don't know. They fired Jeff Sessions, so.
He's a monster.
He could come back at any time.
He's Satan.
He's hiding in the bushes.
He's
right
the
now.
reason they're like, oh, you can only have 90 mmGs of pain medicine ever. Well, what if I get cancer? You can only have 90 mmGs of pain medicine ever. Like, but I'm on 200.
No. Somebody, and I hate that he got fired. I really do. They did the wrong shit, because what should have happened is somebody should have shot him in the leg.
And then been like, oh, sorry, you can only have
90 mmGs.
No, he would have been grandfathered in because he would have had that sweet, sweet government insurance.
Sorry, it's MMBs. Milligrams of morphine equivalent.
No, just chop off his leg. And then see how he does with 90.
I said I would never wish my disease on anybody permanently, but if you could get CRPS for a year, I would do cartwheels on my effed up hand. And
slam his hand in a door.
That's not guaranteed. He might just break a bone.
Yeah, I don't know what the factors are for people
He's a
getting
goblin.
CRPS,
He'll just grow the limb back.
The best case, right? The best case, it's still painful. Didn't you watch that MIB movie? The best case scenario that you could wish for him that's even close to MSRP is to cut off like a leg. Cut off a leg, and then he will have a foot that always aches.
Yeah, you can have phantom limb syndrome.
Yeah.
Same thing. Okay, well, guys, thanks for watching. And Mina, I'll keep you in my thoughts. I hope you feel better soon.
Did you just send somebody thoughts and prayers?
No,
I sent thoughts.
Oh, okay. No prayers.
No prayers.
You're
just
not
thoughts.
good enough for those. No, you're going to click the wrong one.
No, I'm not. I'm doing it right. See?